Welcome, everyone. I'm excited to welcome you to our comprehensive and grand presentation for medical coding students. Today, we'll be exploring the latest official updates for 2025, including new codes, revisions, and instructional notes. We'll also look at how to step into your success with Visu online medical coding training. Plus, I'll walk you through the updated ICD-10CM guidelines for 2025. So, let's dive in and get started. Let's take a closer look at the International Classification of Diseases, 10th Revision, or ICD-10CM. This is the standard system used for reporting diagnoses in the United States. It's maintained by two key organizations, the CDC and CMS, which ensure the system stays current and accurate. ICD-10CM is essential because it underpins many critical functions in healthcare, including billing, reimbursement, and maintaining compliance with regulations. Without it, navigating the complexities of healthcare documentation and financial processes would be much more difficult. In essence, ICD-10CM is the backbone of how we communicate about patient diagnoses officially and consistently across the country. Understanding this system helps us ensure accurate reporting and proper reimbursement, which are vital for delivering quality care and maintaining the integrity of our healthcare system. Now, let's take a look at some of the key updates for 2025. First, there's the addition of new diagnosis codes, which means we now have more precise options to document patient conditions. This helps ensure accurate reporting and better patient care. Next, you'll notice increased specificity in many categories. This allows us to capture more detailed information about diagnoses, which is essential for proper treatment planning and reimbursement. We've also revised the excludes 1 and excludes 2 notes to clarify when certain diagnoses should or shouldn't be coded together, reducing confusion and improving compliance. Additionally, the updated documentation guidelines provide clearer instructions on how to properly document diagnoses, supporting more accurate coding. Overall, these major ICD-10CM 2025 updates are designed to enhance the accuracy and clarity of medical coding, which ties directly into our ongoing goal of improving documentation and patient care quality. Let's take a closer look at the structure of the ICD-10CM official guidelines. It starts with Section I, which covers conventions and general guidelines. This section provides the foundational rules and principles that guide us in accurate coding. Next, we move to Section II, focusing on the principal diagnosis, which is key because it identifies the main condition treated or investigated during the patient's stay. Then, Section III addresses additional diagnoses, highlighting how to properly document and code other conditions that coexist or affect the treatment. Section IV covers outpatient coding guidelines, which are essential for outpatient settings where coding can differ slightly from inpatient scenarios. Understanding these distinctions ensures our coding is precise and compliant. And finally, the guidelines are organized within the ICD-10CM official guidelines structure, giving us a standardized framework to follow. By understanding this structure, we can apply the guidelines more effectively, ensuring our coding is consistent, accurate, and aligned with official standards. This overall organization helps us stay on track and reinforces the importance of each section in the broader context of proper coding practices. Let's take a closer look at the rules found in the tabular list and the alphabetic index. These are essential tools for accurate coding, and they help ensure consistency and precision in our work. One key point to remember is that punctuation symbols play a significant role in guiding code selection. For example, brackets, parentheses, and colons are not just punctuation. They help specify the correct code or indicate additional information. It's important to note that these symbols are included in the guidelines, along with references to NEC and NOS notes, which are crucial for understanding the context and proper application of codes. However, certain notes like excludes 1 and excludes 2 are excluded from these rules, so we don't apply the same guidance to those. All of these conventions are part of the ICD-10CM guidelines, which serve as the foundation for accurate and consistent coding. By understanding and applying these rules, we can ensure that our coding is both precise and aligned with official standards, supporting the overall accuracy and integrity of medical records and billing. Let's take a closer look at how we use synonyms and explanatory phrases in coding. For example, consider the code K3580, which stands for acute appendicitis without perforation. The brackets you see contain the manifestation codes from the alphabetic index. These brackets, are really helpful because they clarify or specify the condition further. They allow us to include additional details or related information without cluttering the main code. This approach ensures our documentation is precise and comprehensive. Overall, understanding how to properly use these brackets and codes is essential for accurate medical coding and reporting. Let's take a look at non-essential modifiers. These are words or phrases that we add to a code but don't change the core meaning. For example, in the case of J45909, which is asthma unspecified, the phrase unspecified is a non-essential modifier. Notice that any words in parentheses, like this, do not impact the code selection at all. They serve as additional information but aren't necessary for coding accuracy. Recognizing these non-essential modifiers helps ensure we're coding precisely without overcomplicating the process. It's an important part of understanding how to interpret medical documentation accurately. Let's take a closer look at how incomplete terms in coding indicate that we need additional modifiers for clarity. For example, consider E11. Type 2 diabetes mellitus. On its own, this code isn't enough to specify the exact nature of the condition. We need to add more characters or details to fully describe the diagnosis. This is where the colon, shown as a convention on the slide, comes into play. It signals that what follows should be an extension or modifier to the main term. This practice helps ensure that medical records and billing are precise, capturing the full scope of the patient's condition. Remember, using these modifiers correctly is essential for accurate documentation and communication within the healthcare system. So, always pay attention to incomplete terms and the colon convention to add the necessary specificity. Let's take a moment to look at some important coding terms. NEC, which stands for Not Elsewhere Classified, and NOS, meaning Not Otherwise Specified. These are used when a diagnosis or condition doesn't fit neatly into a specific category. For example, if we have a case like J189, which is pneumonia without a specified organism, we might use NEC or NOS. Essentially, NEC is used when the diagnosis is more specific, but still falls outside of other categories, while NOS is more general or unspecified. Understanding these distinctions is important because they help ensure accurate documentation and billing. They also connect to the broader theme of precise coding, which is crucial in healthcare for clarity and proper reimbursement. So, always pay attention to whether a condition is classified as NEC or NOS, as it can impact how the case is recorded and processed. Now, let's look at some important concepts related to exclusions in coding. First, excludes one, and this means that two conditions cannot be coded together. For example, if a patient has a congenital form of a condition, we wouldn't also code for an acquired form of the same condition because they are mutually exclusive in this context. Think of it as a strict rule. You cannot assign both codes at the same time. Next, excludes two is a bit different. It indicates that a condition is not included here but may coexist with other conditions. So, unlike excludes one, excludes two doesn't say you can't code both. Rather, it highlights that the condition isn't part of this specific category but can occur alongside other diagnoses. It's important to understand the distinction between excludes one and excludes two because it directly impacts how we assign codes. Excludes one is a strict, must not code together rule, while excludes two simply signals that the conditions are separate but can coexist. By grasping these differences, we ensure our coding is both accurate and comprehensive, which ties back to our overall goal of precise documentation and billing. Now, let's talk about the importance of right, left, and bilateral specificity in coding. It's crucial to specify which side is affected to ensure accuracy and proper documentation. When we use combination codes, they help reduce the need for multiple codes by capturing complex conditions more efficiently. This not only streamlines the coding process, but also improves clarity. Accurate documentation is absolutely critical because it ensures that the codes truly reflect what happened and supports proper reimbursement and data tracking. Looking ahead to 2025, the focus on laterality and combination codes will become even more important, emphasizing the need for precise coding practices. Overall, understanding these key points helps us stay aligned with upcoming changes and maintain high standards in our documentation and coding efforts. Let's talk about some key benefits of developing strong coding skills. First, avoiding claim denials is crucial. When coding is accurate, insurance companies are less likely to reject claims, which means faster reimbursements and less hassle for everyone involved. Next, improving coding accuracy directly impacts the quality of healthcare documentation and billing, leading to better compliance and fewer errors. Enhancing audit performance is another important aspect. Precise coding makes audits smoother and helps identify areas for improvement. Now, on a broader note, mastering these skills can open up more job opportunities in coding companies and healthcare organizations. For students and freshers especially, this is a golden chance to build a solid foundation for a rewarding career. It's important because, as healthcare continues to evolve, the demand for accurate and efficient coding only grows. So, developing these skills not only benefits your immediate career prospects, but also positions you well for future growth in the industry. Let's wrap up with the Master ICD-10CM 2025 guidelines. It's essential to understand conventions clearly, and I recommend reviewing examples to solidify your grasp. Practice real-time scenarios as much as possible. This will build your confidence and improve your accuracy. Remember, you can join our Visu online medical coding training to learn from anywhere and at your own pace. This flexibility is designed to help you step confidently into your success. In conclusion, mastering these guidelines is a crucial step toward becoming a skilled medical coder. Keep practicing, stay curious, and leverage the resources available to you. Thank you for your dedication. You're on the path to achieving your goals.